Hello everyone, today I'm going to talk about insomnia. The most important strategy to treat for insomnia is not medicine, it is cognitive behavior therapy. In the cognitive behavior therapy, there are so many strategies. The most important one is sleep restriction. That means don't spend too much time in bed if you are unable to fall asleep. So, for example, that when you wake up in the middle of the night, say at 1 o'clock, that you are able to fall asleep. And it may take about an hour or so for you to fall back to sleep. So what were you doing at that time if you were unable to fall asleep? Some people will just stay in the bed waiting for the time to come so you can fall asleep again. It's not recommended because you may feel frustrated if you're unable to fall asleep at that time. You may think about the work, you may think about a lot of things that keep you more worried about. So what should you do at that time if you are able to fall asleep? Actually, you should get up and then do some boring stuff that makes you sleepy, like reading some textbooks, which is good for your study. You know, textbook is always boring and you most likely will fall asleep. And when you feel sleepy, then you go back to bed. If you are able to fall asleep again, then just get out and do some boring stuff again. So just to repeat doing that, you may find it, finally you can fall asleep. It's okay if you are unable to fall asleep during the first few nights. That's fine. So imagine you don't sleep well for a couple of nights, for 3 nights in a row, then you will definitely fall asleep on the 4th night. You will sleep straight through the night. I guarantee you, because I have seen so many patients that they can't fall asleep and toss and turn, having difficulty time in falling asleep. But if they get sleep deprived for a few nights, they will usually sleep soundly on the 4th night. It's just a way to train your brain how to sleep. If you're unable to fall asleep, just get out of bed and do something else. But don't play with the phone, don't work on the computer again, because these iPad, computer, phone will keep you very excited and you won't fall asleep at that time. So I would want you to stay away from all the electronic stuff. So that is sleep restriction. You cannot spend too much time in bed. So when a patient coming to see me, I will always ask when you go to bed, when you get up, and how many times you wake up in the middle of the night. And we try to calculate from when to when that you have a solid sleep. Like if you go to bed at around 10 p.m. and you are unable to fall asleep until 12 midnight, and then I would suggest you just go to bed at 12 midnight, because in that way that you may fall asleep faster. So if you wake up around 6, however, you think you don't sleep enough, then you may still stay in bed until 8 a.m. So I would suggest you just to wake up at 6. So from 12 to 6 is good enough for you. And we do it for a couple of weeks and then to see how you do. The next time, we will calculate sleep efficiency. If you sleep very efficiently, like the 90% of the time you spend in bed is spend your sleep, then I will continue doing that. If your sleep efficiency is less than 85%, then I will say we'll cut off your bedtime, like by 15 minutes or 20 minutes. We try to shrink the time you spend in bed in order to get more efficiency. So that is the concept of sleep restriction, and it train your brain that the time you spend in bed is the time you spend in sleep.